I'd like to thank the Rotary
Want me to sign afterwards?
for having me here for something that doesn't have anything to do with showboat. We gave this talk last Sunday morning at the Men's Breakfast Methodist Church, so Lee has it all memorized already. Obviously, there is a great deal of heat and light and storm and fury going on around the country about the Affordable Care Act. And I would like to present a summary of the reality beneath the politics of healthcare reform in this country. I'm going to stay out of whose position is what and explain what the problem is in healthcare in this country and how we've gotten where we are and what needs to happen from here, irregardless of the politics. And then each of you will have your own part to play in that as you see fit. Back in 1980, when I was in medical school, I did a fourth-year rotation in emergency medicine. And that required 4 weeks at Ben Taub Emergency Room in downtown Houston, back when Houston was the murder capital of the country. And they had these two rooms called trauma rooms. And approximately every 45 minutes to an hour, the trauma bell would go off, the ambulance would scream up and deposit a trauma victim, usually someone who had been shot or stabbed. They would call them that they were the victim of the Dude brothers. Who shot you? Well, this dude and that dude did. But what happened is this person, partially responsive, was put on the table, and then one physician was put in charge of trying to save that person's life. And while he was working on that, there were 4 other physicians in the room critiquing and offering often conflicting suggestions. There were 4 nurses trying to explain to the doctor what they were not doing correctly or were doing wrong or was forgetting to do. And the patient was usually either inebriated, intoxicated, or didn't enjoy the pain of having things stuck in them, so they were thrashing around on the table at the same time. The doctor did not have a choice as to whether or not to stop doing this. But you can imagine that that physician had an incredibly difficult and stressful job to do. What I posit to you is that America is on the trauma room table right now. And there are a few people who are trying to save the patient. And there are a great many other people in the room. Here is the problem. Here are the diagnoses of the patient. In the United States healthcare, we pay twice as much per capita than any other country in the world. $2 for every $1 spent for the same basic healthcare services. We have the 11th best results. Our infant mortality rate is worse than the 100th in the world. That's the number of children under age 1 dying. Our insurance costs before the Affordable Care Act were rising 2 to 5 times the rate of inflation, often double digit. Our medical costs for equipment, drugs, doctor visits were rising at 2 to 3 times the rate of inflation. Medical equipment and drug manufacturers were receiving what I perceive to be obscene profits. Anybody heard of the hover-round chair? Okay, before the Affordable Care Act, the hover-round chair cost $2,500 to make. Once a doctor writes a prescription for it, the government got a bill for $9,500 because it was covered by Medicare. Who set Medicare rates? All Medicare reimbursement rates are set specifically by congressional law, not by any private firm. Medicare reimbursement rates for every service are set by congressional law, by law. Orphan drugs. There were many generic drugs, very inexpensive, that didn't seem very profitable for drug companies to make. One example is colchicine for gout. Cost approximately 2 cents a pill. But manufacturers decided they didn't want to manufacture it, and so one company applied for it and got a new patent for the name Cold Chris. It is now $2.50 a pill. It is exactly the same chemical. I cannot write a prescription for generic colchicine. I must write for Cold Chris. We also have problems with our own choices. If a patient comes to me and I give them advice about how to control their behavior and prevent heart attack and stroke and stop smoking, eat correctly, I get paid $40 at the top end. Some plans as little as $15. If that patient continues to do poorly and has a heart attack and goes and gets a stent, the pay is $25,000 to $50,000 for that stent and the hospitalization that surrounds it. And if they don't change their behavior, they will need a new stent every 18 to 36 months for the rest of their life. Insurance policies were covering less and less. 10 years ago, a typical deductible was $100 to $500. As of 6 months ago, deductibles of $2,500 to $5,000 were commonplace, with higher insurance premiums and fewer things covered. So we have a choice. We can let it go as it is, in which case the entire country will go bankrupt. We can establish a system where one entity pays for everything, like many countries do. That's called the single payer program. Something that many politicians would rather die than say. We can allow we can allow a marketplace of insurance companies but make sure that everybody's paid. Because if you only have the sick people buy insurance, then they go broke. Why is there an insurance commissioner and a mandatory auto insurance in every state in the union? Because when people get hit by uninsured motorists, they don't like it much. They want so that people who are safe drivers and the people who are reckless drivers all buy auto insurance so that none of us go broke. If you don't have that model for health insurance, everybody goes broke because it's too expensive to pay for everything. So again, our choices. Leave it alone. Have one payer, be that a company or a government, or have a network of insurance companies that compete for your business. The Affordable Care Act chose a network of insurance companies, but everybody has to get insurance. The goals. Set a level of minimum care. Just being insured, having a health insurance program that only covers diseases starting with the letter E is not very good insurance. But you have to have health insurance that is a certain standard of taking care of people. Set a maximum amount of profits. Again, if health insurance costs are going up 2 to 3 times inflation, and health insurance premiums are going up 2 to 5 times inflation, some money is going into the pots that's not coming out. And even though many insurance companies are labeled as nonprofits, they still make a great deal of money. You set aside what are called carve-outs. All insurance has to take care of an emergency room visit. All insurance has to take care of preventive health care for your children. All insurance has to take care of physical exam parts that help save lives. You offer choices. You let every company and country compete for that. You subsidize for lower income, and you have a penalty for not signing up, just as you do for auto insurance. If you don't sign up for auto insurance, you get in trouble. And that is where we are. Now, has it been implemented well? Of course not. Was Medicare implemented well when it started? No. Remember the donut hole? The Affordable Care Act closes the donut hole, folks. It's not working yet. But that's because the trauma room is full of people that don't want you to fix the patient. Now, there are several myths out there about the Affordable Care Act. One is the so-called death panel. The death panel is going to decide that at age 75 you're going to be put on an ice floe and shipped off to sea. That you're no longer going to get paid for things. Unfortunately, a great deal of that was paid for by the medical device manufacturers who saw their profits go down. If I put an obese diabetic person who is able to walk on a hover-round, I immediately shorten their life by 2 to 3 years. But they don't say that when they call the patient at home and say, wouldn't you like to have the freedom to go anywhere you want? The so-called death panel, what their job is to do is to look at medical devices and say, does this improve lives? Does it add to their lifespan? Does it make them healthier? If it doesn't, the government's not going to pay for it. That's all that says. It doesn't set an age limit. It doesn't say that you don't get any health care at a certain age. And I've been asked about this last month. After the first of the year, I'm 82. Am I going to be allowed to see you as a doctor? Yes. Hasn't changed it. Next myth is that the IRS will have access to health records. No, the IRS explicitly in the law does not have access to health records. It has access to whether you have health insurance, even though it is specifically barred from enforcing that part of the law at present. Now, I will point out to you that your health insurance company does have complete access to your health records. And at Family Doctors of Vicksburg, you all know that Sue Dornbos is fighting and winning her battle against ovarian cancer. And 3 months after her diagnosis, we were informed that Family Doctors of Vicksburg, if they wanted to keep their current policy, would double their premiums. A 100% increase in premiums. Everybody else is nice and healthy. So if you're wondering who to be concerned about having access to your health information, it ain't the IRS. Statement that costs will double, okay? Costs will go up. Costs have been going up for the last 25 years. But if we had not had some action on healthcare reform in some format over the last 7 years, and our health insurance premiums were going up at 10 to 15% a year, my financial advisor tells me that 10% a year, you get double your money in 7 years, thanks to compound interest. So yes, our costs would have doubled without health care reform. And so they'll go up. I don't think they'll go up double. Those who have will get no change. Well, we've obviously seen that this week that won't happen. But I would point out to you, as has been pointed out on some of the fact sites on the internet and in the media, that the insurance companies were in charge of, or were involved in all of the planning of the Affordable Care Act when it started 5 years ago. And they knew that this was the date in which the marketplace would open. And they set the grandfather expiration dates for their policies. I wonder if there might be a connection. But wait a minute, the insurance companies all wanted, they were publicly in favor of the exchanges. Forbes magazine pointed out that even though the public opinion, the public position of health insurance companies in America was in favor of health care reform, they have been paying $103 million per year to the Chamber of Commerce of America to buy ads opposing the Affordable Care Act. People who are going to see their profits go up 2 to 5 times inflation, and now are only going to get it at inflation, are fighting it. This should not be a surprise. There will be changes because it's a free market. This is not a government-run healthcare. The government has said, companies compete. Everybody, you got to pick an insurance company. If the insurance companies want to give you crappy choices, you will get crappy choices. But you ask for freedom, you got it. The myth of that you will have no choice of who your doctor is, that's a myth. Family Doctors of Vicksburg currently accepts 25 brands of health insurance. Every year, about 15% of our patients change health insurance plans. The majority of the time, we continue to be their doctor, we just bill somebody different. This is not, as I said, this is not a government takeover of healthcare. The government doesn't get to pick who your doctor is. The government doesn't get to pick who your health insurance company is. You can sign up for anything you want. For right now, you can even go uninsured if you want. But sometime in the next few years, if we're going to not go broke, you're going to have to pay for that choice. And the fee for not signing up for health insurance is a little bit more than what your premiums would be. There's another myth that says that we're forcing employers to move from full-time to part-time. If you go to the Kaiser Family Foundation website, nonpartisan organization, and also look at the General Accounting Office nonpartisan statistics, you'll see that the transition between full-time jobs in America and part-time jobs in America made a dramatic shift in 2005 during the George W. Bush administration. And it has been relatively flat since. Do we have massively more part-time workers in America? Yes. Did it have anything to do with the Affordable Care Act? No. The health insurance industry currently has 6 full-time lobbyists for every single member of Congress. And their job is to be at that congressman or senator's office every day. In addition to that, there's physician groups. I make less than 2/3 of family physicians in the country, and family physicians currently make less than 2/3 of the doctors in the country. And we're watching our patients die and go broke. We don't like that. So we have been talking about healthcare reform for 25 years. Before the campaign between President Obama and Senator McCain, we had this information and presented it to both the Democratic National Committee and the Republican National Committee. Said, we're concerned about our country. The Republican National Committee, and again, the people who did this are personal friends of mine. Dr. Ted Epperly and what's Carol's last name? I'm blocking on it. Oh, Lori. I'm Dr. Lori Hine. They were part of the group, the American Academy of Family Physicians. They went to the Republican National Committee and presented this information, said we need to save this patient. The Republican National Committee said we are not interested. It will not be part of our campaign. Democratic National Committee said we will do our best. And so none of this was a surprise to any player long before the Affordable Care Act was proposed. However, physicians who are paid by procedure, surgical subspecialists, cardiologists, the ones who get that $30,000 to $50,000 for putting that stent in, they don't want to make less money. It costs $200,000 to pay for medical school. They don't want to go into debt. So they have some complaints about changing the current status quo. Device manufacturers don't like the current situation because they're going to make less money. But if they continue to make the money they have, we all go broke. Pharmaceutical companies don't like the current system. They have lobbied in the last 3 years a law that says it is illegal for any military or civil group to negotiate with them for a discount on the current Medicare rates. Illegal. The only way to change the Medicare rate for what you pay for a pharmaceutical product is to pass a law directly through Congress. The people who sell poor choices also don't like this idea. How many of you go into Speedway? In Speedway, there's, I think some of the cheese and crackers, the roller grill egg rolls, vegetable egg rolls, and the water are healthy choices. You could get by with a coffee if it's a small or a medium. Everything else has evidence that shows that it harms our bodies. They make a lot of money. We are also people who make the poor choices. We are also the person on the table thrashing, saying, don't save me. So, bottom line, not saving the patient is not an option. The current law is clearly imperfect, clearly needs fixing. But until our leaders commit to fixing it, all of our families are at risk. When the Affordable Care Act was passed, there were 45 million people uninsured. These were not Medicaid patients. These were our children with part-time jobs, 2 part-time jobs, who couldn't get health insurance. Those people had a 52% higher mortality rate than the rest of the population. You do the math, that's 180,000 premature deaths a year. That's a World Trade Center every 10 days. I don't think that's acceptable. So our choices are either to tell what we want to fix it and tell our leaders to fix it, or let the patient die. Going back to where we were is like the guy with a heart attack saying, let me go back to my cheeseburger. Don't put that stent in me. We have to save the country. What each of us can do is to make a voice that says to our leaders, fix it. Make it right. Stop arguing and fix it. With that, I'm open to your questions. Didi.
With the situation that we have right now, yes, we need to do something, but the fact is, you and I, we have to adhere to the STAR rate.
Mm-hmm.
What would be the impact? Maybe you can elaborate what it is to our members. The impact on the relationship between the patient to you and then to us.
What will basically happen is if we don't insure everybody, patients will come to the emergency room and pay 20 times the normal rate for each visit for a cold, which will not be paid by them because they don't have any money, so it will be paid by us. That's 2% of the excess cost right there. Or people will just stay home and get sick. Saw a patient today, was not allowed by her job to have health insurance, and was not allowed by her job to take time off during work hours to come see the doctor. So they had a disease that I could have taken care of easily 12 days ago that cost twice as much to fix today. What we have to do is we have to expect that each other and our employers be stewards. We treat our people as well as we treat our equipment. We have to value them as much as we treat our equipment. Teddy Roosevelt's father said it very well. Good fortune must be balanced. God requires a good fortune be balanced with productive work and public service. If you're in a position where you have profited from this country, you pay the country back by being a good citizen. We're not doing that. Not at the low end of the income spectrum, not at the high end of the spectrum. So the first thing we do is we do what Rotarians do. We say what's true. We do what's right. And we do it for the people that work for us, and we do it for the people we know in our street. We are in an incredibly blessed place in Vicksburg. Family Doctors of Vicksburg is probably 1% of primary care is being given by self-owned small group practices these days. And funny, we don't do it, we don't have to see 45 patients a day, we don't have to screen people through, and yet we're not out of business. If we trust that stewardship works, then there will be more stewards. I hope that answers your question. Sir, go ahead, Pete.
One more question. What was the impact? Because by 2014, the reimbursement to you from this insurance company is based on the adherence from the patient. Assume that you have 20 patients that is not even close to doing what you're supposed to do, and your ratings going down because of the readmission to the hospital, the emergency room. What would be the impact to them?
Well, right now, our reimbursement rates are not going down. They're pretty steady. We might go down 3 or 4%. Now, why are ours going down? Because Republican and Democratic people like Newt Gingrich and Hillary Rodham Clinton got together and said, you know, when you have an electronic health care record, things get done more easily. And we will give you a carrot up front if you'll do it, and we'll make you pay a stick by getting less from your Medicare patients if you don't. And we're now in the stick part. But we got an electronic health care record 3 years ago, and guess what? Our reimbursement is not going down. And we're going home 30 minutes earlier each day. And when somebody calls and says, I want to know what my PK x-ray is, I can say, here it is. Instead of go down there, get it, and bring it back to me, and we'll look at it together. Costs go down, healthcare goes up, nobody goes out of business. Stewardship. It can be done. Sir.
Some time ago, I talked to Tom George, and he had quite a lot to say about Blue Cross and Blue Shield, and you mentioned the fact that they could have tax exemption. I think that was the big deal that Tom was so mad about, is that, you know, when they were working with the big three, and then Blue Cross said, well, we'll do the insurance of last resort by having tax exemption. Now, how many other companies have tax? It seems like you got to start someplace where you level the playing field, so they can lower their rates and then screw everybody else.
I don't know enough about the different insurance companies to tell you where that level playing field is. But the people who level the playing field are not talking to each other.
Right. That's, you know, and you're
They're
saying,
smart
"Gotta
enough
fix
to
it."
do
It's
it.
like, well, there's so many things to fix. It's like, where do you start? It's
You
like,
start by putting people in office that agree to be stewards, and you hold them accountable for being stewards, which I'm pretty sure was how we founded the place. And if we start looking at the facts, and holding our elected officials accountable for the facts, then it gets done. If we take the sound bites and react to the sound bites and say, that person needs to have his spleen taken out through his ear, nothing happens. Each morning I look at CNN.com, Vox.com, and NPR.com, and a site called politifact.org, which checks the facts on the stories by those other three sites. And then I hold my elected officials accountable for what the reality is. And I spend a great deal of my time on Facebook pointing out the facts when people push inflammatory, statements like, Mitch McConnell eats babies for breakfast, and Barack Obama has been worshiping Satan on Tuesday afternoons. Those kinds of things. No, okay. You talk, a conversation about the facts, and you hold people accountable. That is our duty as citizens. And that's what we can do to change this. Other questions? Sir?
The other day on Squawk, there was somebody, they were talking why America's healthcare costs are so high. And one of the experts, that everybody has on TV, said a major reason is because doctors in America prescribe way too many tests because they're so afraid of lawsuits. They don't take a chance. They test. For in other countries, that doesn't happen. Does that sound like a statement or not?
The defensive medicine argument has been losing ground in the last 5 years because in many states, such as Michigan, we have tort limits. So that was true 5 to 10 years ago. It is less true today. As a matter of fact, the American Academy of Family Physicians has every 3 months been putting out the 10 things to stop doing this. And because they have done the studies and shown that it doesn't make a difference anymore. Used to be, everybody got a PSA test. Every year, every man from age 50 on up. The research has shown that in people who don't have a family history of prostate cancer, if you do a PSA test every year, you end up hurting more people by doing unnecessary biopsies than you save lives from cancer. A more egregious example. How many here have gone through lifeline screening? Usually in church, some weekend or something like that. Have you heard of them? Lifeline screening will come, set up, and for $200 they will do this battery of tests that will ensure you won't be hurt.
The machine doesn't.
The carotid artery screening portion of that has been shown conclusively to kill people because the false positives lead to unnecessary surgeries that end people's lives. But yet, even though that's been conclusively proven, you can still, and oh, by the way, you know that the AARP and the Military Officers Association of America will advertise those services because they get paid for every one of their members who goes and has a screening done? A test that is known to kill people? The cost is because tests that seem cool are easy to sell and are cool. And so people will buy the test. And they are not marketed by physicians. They're marketed by people who own the equipment. When I go to an American Academy of Family Physicians meeting, at every exhibit hall, there will be at least 20 people who will show a new test. And they don't say, this will save 10,000 lives a year. They say, you will be able to recoup the cost of this equipment in the first 4 months with your billing. There's where your cost problem is. Back when we started to have this problem, we said, healthcare is not a profession, it is a business. And we have been paying for that ever since. Sir?
Can I suggest, being this is the second time I heard you talk, that everybody listen to it again, because then you're ready to comprehend the things that you said. The results of our little men's church group was, how do we change it? And how do we affect change? And I opened my mouth and said that, so I have the assignment to expose how we affect change, and the only way to do it, of course, is getting involved.
That's right.
So they'll have to listen to me for a half hour, telling them how I got involved.
But again, the basics of it are listen to facts rather than sound bites and communicate with your representatives. Let them know that you're paying attention, that they expect a steward, not a combatant, and that you're watching. That gets their attention. Do you have any other questions? I thank you for your kind attention, and I appreciate it.